Welcome. This is Jean Eaton with Information Managers. It's my honor and pleasure to have you today for our Practice Management Nugget webinar, When You Close Your Healthcare Practice. Closing or moving your healthcare practice. This is a big step for all of us working in healthcare. And whether or not you're just starting out or that you are closing the end of your career path, or you're somewhere in between, you're buying or selling or accepting new people into your practice, the way that you manage those patient records becomes very critical to the success of your expansion or exit strategy. So that's what we're going to focus on today, is about how you are going to manage those patient records. And this is something that I find is a trouble spot over and over and over again. And with many of the healthcare colleges and standards of practice, this is one of the areas that they find is the most frequent sources of complaints, not just from patients, but also from the healthcare providers on their teams. So when you close your healthcare practice, how to manage your patients' health records. This episode is one of our weekly podcasts with Practice Management Nuggets. And we talk about all things that affect how you open, grow, maintain, expand, and to close your practice. So this episode is going to focus on managing your patient's health records when you close your healthcare practice. My name is Jean Eaton. I am your practical privacy coach with Information Managers. So my background in healthcare is over 30 years of practice working in healthcare in Canada. I have been a director of health records in a variety of hospitals across Canada, so I'd like to call myself a Canadian gypsy. As a certified health information management professional, I have worked in all aspects of acute care facilities as far as collecting information, as far as patients coming into inpatients, outpatients, hospital-based, specialist services, and a variety of other not-for-profit and other types of community-based organizations. My practice now is focused on primary care practices. So I work mostly with private care healthcare providers, and that may be including physicians in general practice or specialty medicine, chiropractors, pharmacists, podiatrists, chiropractors, physiotherapists, independent private nursing clinics, and a variety of other types of primary healthcare practices. So we're going to focus on those primary healthcare practices where the individual healthcare provider or a group practice is the organization that manages the patient records. So for today's conversation, we're going to mostly exclude those larger health regions or cancer care clinics that are managed by provincial bodies. We're going to take a look at those private practices and what they need to do as far as managing their patient records when they open, close, move, or expand their practices. So the very first thing to understand about your practice is that you are based on a trust relationship with your patients. Patients and clients have a unique trust relationship with their healthcare provider. They trust that you will provide them continuing healthcare and continued access to their own health information that you have recorded. You are also expected to securely keep those personal health information and to follow your professional college standards and health information privacy laws. So each healthcare profession largely has a college that has standards of practice. So you need to follow those standards of practice wherever that they exist. In Alberta, the Alberta College of Physicians and Surgeons has a fairly robust procedure and policies about the standards that they expect their healthcare physicians to provide. In Alberta, we have the Health Information Act, which again provides additional details about how patients' information will be collected, used, and disclosed, and how patients will continue to have access to those records. So for the purpose of our webinar today, anytime that we talk about the Alberta experience, whether it's from the college or from the Health Information Act, you can use that as a guideline as best practices. But always remember that you are going to have to check with your own particular colleges and standards of practice and other privacy legislation that applies to your particular practice. When those standards don't have a lot of detail, these are good standards and best practices that you can use to give you some guidance as to what you need to do and implement when you are closing or moving your healthcare practice. Closing or moving a healthcare provider practice takes coordination, patience, and communication and documentation. Once you've made the big decision about closing or moving and have a general idea about the next step for you, your practice, and your employees, and your patient and business records, you need to get started to develop that plan. So this applies not only when you open a practice, you close a practice, or perhaps you're selling or buying a practice. I want you to remember that there are a number of things that you need to think about. And don't always assume that the next healthcare provider is going to take ownership or custody of those patient records. That isn't something that happens all of the time. And in often cases, the new provider is not required to accept your records. They might want it because it might be part of the good faith or the client or patient base that they are buying the goodwill for your practice, but they don't necessarily have to accept that. So that's one of the common misconceptions that I see on a regular basis. So whether you are at the end of your career or you're moving or leaving your current practice, you have a number of responsibilities when it comes to protecting the data that you've collected from your patients. In the absence of a healthcare provider's regulatory college requirements, these standards are reasonable best practices that other healthcare providers can adopt for their records management practices. These practices apply whether or not you have your patient records in paper format or electronic format, or a bit of both, what we call the hybrid record. In the electronic format, you might have an official electronic medical record or an electronic health record, or you might just have a variety of documents that you've maintained in your computer network system. They might be transcribed reports, copies of fax documents, letters that you've sent on behalf of the patient. So one of the key things that you need to do is have a really clear understanding about what documents that you have in place. What is your inventory of those documents? So we're going to talk about how you manage that inventory of information. Remember, though, that it could be in paper format or electronic format. You have three key areas that you need to consider when you're preparing for closing or moving your practice. You need to think about how you're going to manage the patient records. You need to think about that notification process, and you need to think about the actual transfer of information. So in the patient records, there are a number of things that we want to consider. Patients need to have access to their information. So you need to first have a clear understanding about what information that you have, and then how are you going to continue to provide access to patients for their information, for their own personal information. So one of the key things that you need to think about is what are all of your existing policies and procedures about how patients will have access to their records. Pull those policies and procedures out now. Take a look at them and make sure that they are current and up to date. You're also going to want to make sure that they are as efficient as possible. So when you only had a couple of patient records requests in a week or a month, or perhaps in a day, now you're going to have hundreds. So if you're talking about a practice that has, on average, let's say 10,000 records for some easy math, you are going to expect that you are going to get patient access requests for those records in the hundreds, if not thousands, for the first few months when you make your decision about closing or moving your practice. So make sure that you have reviewed your practice and that you have an efficient process to be able to manage those requests. You might even consider hiring additional short-term staff or perhaps a contractor to be able to help you with just this step about managing access to patient records. You're going to get a lot of requests for this information, and you're going to be very busy with other things that happen with the movement of your records. So don't underplay the requirements for the need for additional support to be able to get you through this process. So an individual has a right to access any record containing health information about that individual that is in the custody or under the control of the custodian or the physician or the healthcare provider, depending on what type of practice that you have. This means that the information in a healthcare record belongs to and must be provided to the patient when it is requested. So you need to make sure that you have an efficient way to be able to make that happen. And you can actually request the patient to help you with that. So in your notice to the patients, there are a number of things that you're going to tell them. And one of them is, how are they going to have continued access to their information? So make that information as detailed as necessary to make it easier for you to receive the request from the patients. So if patients are notified that you are going to leave your practice, they're going to want to find out, how can they get access to their information? How can they get information for themselves to have as part of their own personally managed patient health record? And how can they refer that information to another healthcare provider that is now going to look after that patient's care? In your notice to the patients, you can provide that level of detail. You can provide a copy of a form that you want patients to fill out that's going to make it easier for you to process that request. You can provide the copy of the form in that notification, or perhaps you have it on your website that patients can download. Now, I don't recommend, unless you've got a lot of technology to help you, that you actually get patients to send you an electronic request for your information, but you can make that form process a little bit easier by providing instructions to the patient on your website and having a form that they can download. Perhaps it's even a PDF fillable form to make it easier that they can fill out the form online and you don't have to translate handwritten information. But providing the more information that you can to make that process smoother will engage the patients, inform the patients, and let them know what their options are, and make it easier for you to process those requests. Now, healthcare providers have a duty to assist the patient when the patient wants to have access to their own information. Under most privacy legislation, including Alberta's Health Information Act, a patient has the right to access their own records about themselves. Healthcare providers have a duty to assist the patient when the patient wants to access their own information or requests that it become disclosed. Healthcare providers will ask the patient questions about what information they want to access and to whom the patient authorizes that information be sent. They want to make sure that they're sending the correct information to the correct person. So you can ask the patients to be very specific about what information that they want to have sent to the next healthcare provider, and ask them, why do you want that information? So you want to make sure that you have a clear understanding about what information that they want to go to that healthcare provider. If you are looking after a family, do you need to send all of the information about the colds and the strep throat and the ear infections that are common to young families? Or do you only need the most recent information in the last 6 months and the immunization schedules? So being more specific will allow the patients to be engaged. It will help them to understand what is currently in the record, because quite frankly, they don't know what you record. And more importantly, it helps you to be clear about what information that you are sending to the person that the patient has authorized. So make sure that you've got a clear practice about how you're going to share that information with your patients. In Alberta, if you are closing your practice, if you're not planning to practice your healthcare services in another location for at least 12 years, or if you're changing your practice considerably, You need to provide 90 days notice to the patients that you are closing your practice. Now, the standards under the college doesn't specify how you're going to provide notice, but you need to do something that is reasonable. So you might be providing a sign in the clinic. You might be putting information on your website. You might be putting an ad in your community newspaper. You might send individual letters to the patients. That's not a requirement under the standards, and certainly that there is a cost component that you need to consider. But providing direct information to your patients certainly demonstrates that you as a healthcare provider are interested and concerned about the continued well-being of your patients. If you are closing your practice, you also need to consider how are you going to advise patients about who else is accepting patients so that they have continued care and treatment of their health care. In those final days when you are closing your practice, you need to be clear about which other healthcare provider will continue to provide reviews for the outstanding lab test results, x-ray test results, and perhaps refills of prescriptions. So perhaps the local pharmacies in your area would be a key individual that you want to provide notification to. So there are other people that you want to provide notices to. And we're going to come back to that in just a moment. If you are moving your practice to another location, maybe it's on the other side of town, you're amalgamating with another healthcare provider, you need to provide that notification to the patients within 45 days in Alberta College of Physician and Surgeons standards. So that 45-day notice, you need to let the patients know how you are going, what your plans are, who are they going to access for continuing care and treatment, how are they going to have access to the records, and if they want to follow you to your new location for continuing care and treatment, how are they going to do that? So those are the types of things that you need to provide at a minimum in the notification to the patients. In the document management tip that we've provided to you, we've got some additional details and references to the college's standards so that you can make reference to them and make sure that your information is complete. I've also provided you a sample form that you can send as a letter to your patients and posters that you might want to consider to add in your practice. Now, there are many ways that we can close a practice, and you're going to need to consider how you're going to notify individuals when you close a practice and perhaps are moving to another location. You certainly need to notify your regulatory colleges and your professional colleges and associations about your forwarding information and your additional contact information. You might need to notify the local pharmacies, perhaps the local hospitals, and any information sharing initiatives that you're involved with about your patient records. You might also need to inform the labs and x-ray departments to cancel your accounts as far as the facility codes to authorize writing new requests for diagnostic testing. You also need to provide those key individuals in the community how they can help you with sharing that information that your practice is being closed. When you start a new practice, you should have what we call an information sharing agreement if there are more than one healthcare provider in your practice. That information sharing agreement is very important to be able to let individuals know what are the roles and responsibilities as far as those records that you are going to acquire in the course of the practice. So you need to make sure that you've identified in those records that you have identified who those key players are going to be, the most responsible physician or healthcare provider. You're going to make some decisions within your organization about who's going to make decisions and have ownership of those custody of those records. So when you leave a practice, that there is a clear understanding when you create that practice about what's going to happen for those patient records. So that might be an information manager agreement. It might be an information sharing agreement. In some jurisdictions, they're called business agreements. So when you are starting to work together and everybody is eager and on board and they want to participate with each other, that's the ideal time to find out what are the rules going to be when somebody leaves the practice. Is everybody going to be responsible for taking those records? So if you've got an active practice with 5 or 6 other healthcare providers and you're acquiring all of those patient records, you don't want to leave the last healthcare provider standing with the responsibility of managing 40,000 patient paper records. And you don't want to be the last man standing to have to take on that responsibility. So make sure that you're having a conversation at the beginning when you're accepting new providers in your practice about how you are going to dissolve that practice. Now, there are many reasons why people will exit a practice, and hopefully most of us move on to other things that we want to continue to do. But sometimes people leave on a bad note. So it's a negative exit for one or more of those individuals. So at that point in time, when feelings are hurt, that there's bad blood between individuals, we don't want to get into a yelling match about who's going to be responsible for those records and how is that going to happen and who's going to pay for that. So when you are starting your practice, or when you are onboarding or accepting new healthcare providers, that is the ideal time to do that information sharing agreement. If you haven't done that, and you are currently in a group practice, whether or not you're planning your exit strategy now or not, please do yourselves a favor and take time now to go through that information sharing agreement or that information management agreement or the business associate agreement about how you're going to manage those patient records whenever that point in time is that somebody is going to close that record or close that practice. If you need some help regarding information manager agreements, we have lots of resources on our website that you can access, and we have upcoming webinars about information manager agreements that we can help you with. So these are steps that you can take now to help you with closing or moving your practice. Make sure that you've identified what your current policies and procedures are as far as patient access to records. You need to do an inventory of your patient records. Now, that might be a fairly easy thing to do if you have an electronic medical record system. You have a central patient index or a registry or a CPI of all of those patient records in your EMR. If you have paper records, you probably still have some type of a central registration system, and that might be in your billing information system. So your billing or fee-for-service software package might have an electronic Rolodex of all of your patient records, for whom one would assume that you have corresponding paper records. So you might want to get your software system for your billing vendor to help you with exporting a file in an electronic format or paper format that you can then create an inventory of records. You want to make sure that you have paper records for all of those records that you have in your registry. If you've gone through a process where you've purged records, you've archived records, and you've put them off-site, then you need to go back and review that inventory of records. Hopefully, when you've done your purging or your archiving, you have recorded what records you have destroyed. That is a requirement under most college requirements and under privacy legislation. So you need an up-to-date inventory of your information. So this are good things that you should be doing if you have not yet made a decision about your exit strategy. Maybe it's 10 years down the road. These are things that you can take a look at now and get prepared. Do your patient policies and procedures about access to records, do your inventory of records, your archiving and destruction log, your information management and sharing initiatives to facilitate you when you make that decision about closing or moving your records. Now, one of the questions I get frequently is who owns those records? Well, when you are creating the record, you are the custodian or the manager of that record, and that includes the information that you have produced about that patient. So it includes the paper files or perhaps the electronic files. The patient owns their own information, so the patient is entitled to have access to their information. So you need to have those things in place. Make sure that when you are releasing that information that you've got that secure file storage, and during that entire time when you are maintaining those records on a day-by-day basis and when you are transferring those records. One of the things that we see on a regular basis is when a physician practice actually closes, they box everything up and they move to the other location, and lo and behold, there are boxes left behind of patient records, or there were patient paper records or other business or employee records that were put in the garbage and are now in the back alley in the dumpster instead of being securely shredded. So these are the types of things that are often found when a physician practice moves or relocates. And these are the things that you're going to get a complaint about and are going to be in the news. And that's not the way that you want to end your practice or move to a new practice. If you are accepting new providers within your practice, I want to caution you that you don't have to accept all of the patient records for that new provider. And you may not want to. At the very least, you should do your due diligence to review the records that the new healthcare provider is wanting to bring to your practice and review them. Do you want to be responsible for these records? Are you comfortable with the way that that healthcare provider has documented and maintained those records? Because you ultimately will be responsible for finding information in those records. If that new healthcare provider has got good administrative practices and policies and procedures in place, you might be very comfortable in accepting those records. If not, it might be something that you really don't want. So don't assume that just because you are opening a new practice or expanding your practice, that you have to accept those records. Be clear about what information that you are accepting from that healthcare provider. So you want to make sure that you have that inventory of records, and not only just the inventory, but also the policies and procedures that that healthcare provider had that relate to that time period that those records were maintained. So if there was a transition between paper records and electronic records, how did that data migration proceed? Who has access to the records? Where are the backups of those computer records? All of these type of information is something that you should have in your inventory from the buyer to the seller of that healthcare practice. Another area of bone contention is transferring the records and the costs associated for that. So make sure you reviewed your policies and procedures and the requirements from your local college requirements about what is the cost required for the transfer of records. Now, oftentimes that is in Canada considered an uninsured service, but what is expected from a healthcare provider to another healthcare provider is that healthcare provider will provide a summary of that information with no cost to that new healthcare provider. If you are using an electronic medical record system, they often have a summary report that you can generate at the click of a button, and it will generate a summary of the most recent lab tests, the most recent visits, the recent prescriptions, the problems and complaints, and you may be required to provide that to the new healthcare provider or the patient without charge. If you need to photocopy paper records or print from an electronic medical record, or perhaps even provide a digital copy, which is your option as to whether or not you want to do that, you need to make sure that you have that good understanding about what those fee structures are. And you will get complaints from patients about that. So you can anticipate that and help your staff respond to those requests. This is not an insured coverage. This is not part of what you, healthcare insurance reimburses us for. These are your options, and this is how we accept payment. If you are the physician that is moving from one practice to another and you want to have a copy of those records with you, or perhaps you're transferring your electronic data from one EMR system to another EMR system in your new clinic, you probably will be required to provide the cost or for that transfer of records. So even the electronic data transfer of records may come with a cost. And you may be providing that to the physician who is signed on as the information manager for that EMR system. You may be providing it to the software vendor. So anticipate that as one of your costs when you are closing a practice. If you are using an EMR vendor, think about the closing costs for closing that EMR system. You might want to have another consultant or a third-party vendor provide a transfer of information so that they become the information manager to electronically retrieve the information. So as you continue to have patients who request records, even after the 90 days notice, you still need a way that patients can access you and request access to that information. So you might need to be able to provide a third-party contact. This physician is no longer in practice. If you want additional information about how to access your records, this is who you contact, and this is the form that you need to fill out, and these are the fees that may be associated with that transaction. So you can hire a third-party contractor or a business or a vendor to do that service for you, but you need to be very clear about what those expectations are, and you must have an information a manager's agreement or a business associate agreements, depending on which jurisdiction that you're practicing. So whatever reason that you have for deciding to close your business, there are a number of steps to ensure that you meet your requirements and commitments to your patients, your employees, your colleagues, regulatory professional colleges, and your legislation. The reasonable safeguards that you implement for the continued access, use, and disclosure of patient records is one of the key components of your information exit strategy. So we're open to take questions that you can enter into the chat box, or you can enter them onto the YouTube Google Hangout. I encourage you to take a look at the document management tip that we've provided. There are 27 pages of steps for you to follow, some sample forms and posters and notifications that you can customize and make appropriate for your practice. We also have information about archiving records, so that if you're going to box records and store them off-site, we have some sample procedures about how you can do that. If you're going to scan and digitize those records, we have a procedure for data quality assurance when you're scanning records. If you move your records from one EMR system or electronic system to another, you're migrating the data. We have some sample procedures for you to consider in that package as well. We have run out of time for our practice management nuggets today. If we didn't get to answer your questions online today, please send me an email, or you can continue to add the information into the chat button. Let's stay connected. We are here just about every Thursday with a live interview. The interviews are available for replay for a limited time. You can join us as a member of Information Managers Network and have access to all these great interviews at a time that best fits your schedule. I'd love to connect with you on LinkedIn. Send us an invitation. You can also request to join our private members group in LinkedIn called Practice Management Nuggets. I'm on Twitter as @InfomanLTD and now on Facebook. I'd be tickled pink if you like us. My email is jean@informationmanagers.ca. Each month, I host a practice management Q&A where you ask the questions and our members contribute to the discussion and the sharing. The replays are available only to members of Information Managers Network. This is Jean Eaton. Stay tuned.